The topic of risks during and after surgery is extremely important and serious. Every year, millions of people around the world undergo various types of surgeries. While many of these patients achieve full recovery, some encounter complications. The severity of these complications can range from minor to life-threatening. In this part of the script, we will discuss in detail the risks that can arise during and after surgery. The most common and immediate risk during surgery is bleeding. Although bleeding is a natural part of any surgical procedure, sometimes it becomes excessive, posing a serious threat to patient's life. In certain cases, the bleeding cannot be controlled, and the patient requires a blood transfusion. This situation becomes more dangerous if the patient is already suffering from anemia or a blood disorder. Moreover, if the wrong blood type is administered during the transfusion due to misidentification, it can be fatal. The second major risk is infection. Since surgery involves cutting into the body and gaining access to internal organs, the risk of bacterial entry increases. If the instruments, hands, or surgical environment are not completely sterile, bacteria can enter the body through the wound and cause an infection. Such infections can be mild, like redness or swelling around the wound, or severe, such as septic shock, which can affect all bodily systems and bring the patient close to death. The third risk is related to anesthesia. Anesthesia is the medication given to keep the patient unconscious or pain-free during surgery. Some individuals have allergic reactions to anesthesia, which can lead to serious problems such as respiratory arrest, a drop in blood pressure, or irregular heartbeat. Additionally, in long-duration surgeries, anesthesia can affect the brain, causing temporary or permanent memory loss or decreased cognitive function. The fourth risk involves accidental injury to organs during surgery. Sometimes nearby organs like the intestines, bladder, or nerves may be inadvertently damaged during the operation. These injuries might not be immediately apparent, but can later result in severe complications that may require further surgeries or long-term treatment. The fifth risk is the formation of blood clots after surgery. When a patient lies in bed for an extended period, blood circulation slows down, increasing the risk of clot formation. If these clots travel to the lungs or heart, they can cause a life-threatening condition such as pulmonary embolism. The sixth risk involves psychological effects after surgery. Many patients experience depression, anxiety, or sleep disturbances following surgery. This is especially true for those who undergo significant physical changes, such as limb amputations or facial reconstruction. These changes can be emotionally overwhelming and deeply impact the patient's mental health. Another significant risk after surgery is poor wound healing. In some patients, especially those with diabetes, obesity, or poor nutrition, wounds do not heal properly. The stitches may loosen, the surgical site may open up again, or the area may become infected, prolonging the healing process. In extreme cases, this can lead to necrosis, where tissue starts dying and requires further surgical intervention. This not only adds to the patient's pain and expense, but also significantly delays recovery. Another danger is allergic reactions to medications given during or after surgery. Painkillers, antibiotics, and anesthesia can all trigger allergic responses in some patients. These reactions may range from mild rashes to severe anaphylaxis, which is a medical emergency requiring immediate intervention. Therefore, a detailed history of allergies should always be taken before surgery, and emergency medicines should be kept ready in the operating room. Sometimes, surgical errors can also occur, such as performing surgery on the wrong site, leaving a surgical instrument inside the body, or making a wrong incision. These mistakes can be life-threatening and are usually the result of carelessness, overwork, or lack of attention. Though rare, such incidents highlight the importance of teamwork, vigilance, and the use of modern technology like surgical checklists and barcode systems to ensure everything is double-checked before and after the procedure. In some cases, the intended result of the surgery is not achieved, and the patient remains in the same condition or even worsens. For example, after orthopedic surgery, a patient may still feel pain or lose mobility. After eye surgery, vision may become blurry or worsen. In cosmetic surgeries, the results may not meet expectations, leading to dissatisfaction and emotional distress. This is especially common in procedures involving appearance, where a mismatch between the patient's expectations and the actual result can lead to anxiety or even depression. Surgical procedures can also weaken the immune system, particularly in patients who are already fragile due to age, chronic illness, or chemotherapy. The stress of surgery and the medicines used can reduce the body's natural ability to fight infections and heal. This makes the patient more vulnerable to diseases in the days or weeks following the surgery. That's why proper rest, balanced nutrition, and a sterile environment are crucial for recovery. Another concern is the impact of surgery on existing chronic diseases. For example, after a major surgery, the blood sugar level of a diabetic patient can rise uncontrollably. Similarly, patients with high blood pressure may experience hypertensive episodes. Kidney patients may face reduced kidney function, and heart patients may suffer arrhythmias or even heart attacks. Therefore, it is essential that all pre-existing conditions be properly managed before, during, and after surgery under the supervision of specialists. One of the serious risks after surgery is hospital-acquired infections. These are infections that patients contract during their stay in the hospital, often due to prolonged catheter use, ventilators, or unclean environments. Common examples include urinary tract infections, lung infections, pneumonia, or bloodstream infections. These infections are particularly dangerous because they are often resistant to multiple antibiotics, making them harder and more expensive to treat. For this reason, patients should be discharged as soon as safely possible, and hospitals must strictly follow hygiene protocols. Another risk is deep vein thrombosis, DVT, in which blood clots form in the deep veins of the legs due to prolonged inactivity. These clots can travel to the lungs, causing a pulmonary embolism, which can be fatal. To prevent DVT, doctors usually advise early mobilization after surgery, use of compression stockings, and sometimes blood-thinning medications. Ignoring these precautions can result in life-threatening complications. Respiratory complications also occur after certain types of surgeries, especially abdominal or chest surgeries. Patients may have difficulty breathing deeply due to pain, leading to shallow breathing and poor oxygen exchange. This can result in lung collapse, atelectasis, or pneumonia. Breathing exercises, chest physiotherapy, and pain management are critical in these cases to restore normal lung function. In some patients, especially the elderly, cognitive decline is observed after major surgeries. This condition is known as post-operative cognitive dysfunction, POCD. Patients may experience memory problems, confusion, difficulty concentrating, or mood changes. Although it often improves with time, in some cases it can be long-lasting. The causes may include anesthesia, the stress of surgery, inflammation, or undiagnosed neurological conditions. To reduce the risk, pre-surgical cognitive assessments and close post-operative monitoring are essential. A long-term risk after surgery is the formation of adhesions. Adhesions are bands of scar tissue that form between internal organs and tissues, especially after abdominal or pelvic surgeries. These can cause chronic pain, digestive issues, or even bowel obstruction, which might require further surgery. While they are not always preventable, modern surgical techniques like laparoscopy can reduce their occurrence. Patients may also suffer from urinary retention after surgery, especially after spinal or urological procedures. The inability to empty the bladder can be painful and may lead to infections or kidney damage. In such cases, temporary catheterization may be required until normal bladder function returns. Another overlooked risk is nutritional deficiency, particularly in surgeries involving the digestive system. After gastric bypass or intestinal surgery, the body's ability to absorb essential nutrients may be reduced. This can lead to deficiencies in iron, vitamin B12, calcium, and protein, which in turn cause fatigue, anemia, or bone weakness. Patients must follow a special diet and take supplements under medical supervision to maintain proper nutrition. Another serious risk is the recurrence of the problem after surgery. In many cases, the issue that was treated through surgery can return after some time. For example, after hernia surgery, the hernia can reappear, especially if the patient lifts heavy weights too soon or does not follow post-operative instructions. Similarly, in cancer surgeries, there is always a risk that the cancer may come back, either in the same area or in a different part of the body. That's why long-term monitoring and follow-up care are extremely important. One of the less talked about but important risks is chronic pain after surgery. Some patients continue to experience pain for months or even years after the operation. This condition is called post-surgical chronic pain and can occur due to nerve damage, inflammation, or scarring. The pain may be localized or spread to nearby areas and can seriously affect the quality of life. It is often difficult to treat and may require long-term pain management, physiotherapy, or even psychological support. Some surgeries result in permanent disability or loss of function. For example, during spine surgery, even a minor mistake can cause paralysis. In surgeries involving nerves or the brain, there's always a risk of losing motor or sensory functions. Eye surgeries can sometimes cause vision loss, and joint replacements may not restore full mobility. These outcomes can be devastating for the patient and their family, emphasizing the importance of careful decision-making and choosing experienced surgical teams. In rare cases, patients develop autoimmune complications after surgery, where the body starts attacking its own tissues. This can happen due to an abnormal immune response triggered by surgical trauma. Conditions like Guillain-Barré syndrome or rheumatoid arthritis may develop or flare up, requiring complex long-term treatment. Although rare, these complications need to be kept in mind, especially in patients with a history of autoimmune diseases. An important financial risk of surgery is the high cost, especially when complications arise. If the surgery doesn't go as planned and the patient requires extended hospitalization, ICU stay, repeat surgeries, or specialized medications, the cost can become unmanageable. This can be particularly difficult for patients without insurance, leading to emotional and financial distress for the entire family. One more risk is dependency on medicines after surgery. Many patients are prescribed painkillers, sleeping pills, or sedatives for the short term, but some develop dependence on these drugs. This is more common in patients who already have mental health issues or a history of substance abuse. Prolonged use can lead to addiction, tolerance, and withdrawal symptoms, which further complicate recovery. That's why all medication should be monitored and gradually tapered under medical supervision. Another notable risk is emotional trauma following surgery. Many patients experience fear, guilt, or regret after undergoing a major operation. Some feel they made the wrong decision, while others struggle to accept the changes in their body. This emotional burden can lead to social withdrawal, irritability, and a reduced quality of life. Patients who undergo surgeries that alter their physical, Appearance or remove vital body parts often need emotional support and counseling to cope with the psychological impact. In many cultures, especially in traditional societies, surgical scars or deformities are stigmatized. This social pressure can affect a patient's confidence and relationships. A person who has undergone a mastectomy or limb amputation might face insensitive comments or discrimination, further worsening their mental health. It's important that society becomes more aware and empathetic, and that psychological care becomes a routine part of post-surgical recovery. There is also a risk related to the body's hormonal or metabolic balance after surgery. Certain surgeries, especially those involving the thyroid, pancreas, or adrenal glands, can disrupt hormone production, leading to symptoms like fatigue, weight gain, mood swings, or even infertility. In such cases, lifelong hormone replacement therapy may be needed, which requires regular monitoring and adjustment. Sometimes patients experience sleep disturbances after surgery. This may be due to hospital noise, medication side effects, pain, or emotional stress. Insomnia and irregular sleep patterns weaken the immune system and slow down recovery. For this reason, creating a peaceful environment using relaxation techniques and avoiding unnecessary medication can help improve sleep quality during recovery. Another danger is family burnout, especially if a patient requires long-term care after surgery. Caregivers, usually family members, may feel overwhelmed, stressed, or physically exhausted. They may have to take time off work, manage finances, or deal with the patient's emotional outbursts, all of which take a toll on their own well-being. It is essential to provide them with support systems, such as home nursing, respite care, or counseling. Finally, there is the risk of losing trust in the medical system due to a bad surgical experience. If a patient suffers complications, negligence, or a lack of empathy from medical staff, they may hesitate to seek care in the future. This can lead to delays in diagnosis or treatment of future conditions. Therefore, hospitals and doctors must ensure transparency, proper communication, and ethical practices to rebuild the patient's confidence and foster a sense of safety.